Everyone, and welcome back to the Osteophysio YouTube channel. Today we are going to be doing something a little bit different. So we're still continuing with our best of series in terms of the best exercises for certain conditions, but we were asked if we could elaborate on our latest video regarding rib pain. So today's video we're going to be looking at understanding rib pain. So what actually triggers rib pain? What are we looking for in diagnosing as people come in to see us as therapists, and what can be done in terms of management and treatment. When someone comes in with rib pain, there's certain criteria that we have to analyse and have to look at. So we look at the rib cage as a whole. So there's lots of different joints and structures that can interact. So if we take anterior rib pain first, the most common conditions that we see in terms of joints and conditions triggering pain around here could be aggravation of the sternocostal and costochondral joints, which blend and attach around here. Slightly lower down into the rib cage, we can have intercostal joint pain, and normally when we've got isolated pain over very specific joints around the front of the rib cage, there's either been a very clear traumatic onset, so trauma into the rib itself, so they've either fallen onto the rib, or for example a seatbelt injury in a car accident or a collision whilst in the car and it presses into the rib or into the sternum, maybe overreaching, so for example rock climbing, reaching up and suddenly pulling or aggravating into the joint, or it could be due to repetitive patterns. So for example, either a position when you're working at a desk, you know, constantly compressing through, or you might have had a cold recently or a cough where you've coughed over and over and over, possibly really strong. It might have aggravated or inflamed into the joints just from overuse. So there's lots of different onsets for that. So that's the first thing we want to work out. Second thing we want to look at is what is the nature of the pain. So most commonly when it's over certain joints, it's very localized, can typically be quite sharp and might have an associated dull ache around the area where the body's compensating. It's normally worse for using the ribs, so coughing, sneezing, laughing typically, which obviously makes it really hard. The person wants to brace the rib when obviously it's triggered with certain movements, maybe lifting up through the arm or lifting forward triggers the pain as well. What we would typically look at treatment wise is we'd want to look at the function of the rib, so how is the whole rib cage moving. We'd also want to look at, is there any other aggravating factors that we can remove, i.e. day to day when they're working. And then treatment wise, we'd want to relax and relieve all around the rib cage and see if we can help improve that function, as well as inflammatory or improving that inflammatory process and taking down the inflammation by adding ice directly to the area. What we also have very commonly is we might have a strain into the intercostal muscles, so the muscles between the ribs. Very similar triggers and aggravating factors as the other joints, but what you typically find is it's more of a dull ache. Obviously it can be sharp, but most commonly a dull ache between the ribs, so they're kind of following it across onto the muscle. They normally feel like it's better for heat, so actually getting blood flow to the area. And again, what we would look at treatment wise in terms of understanding the rib pain is what's aggravating it day to day. Is it a certain position that we can help improve, and can we work to open up and articulate and move through the ribs to take the pressure off those intercostal muscles. If we're thinking about understanding rib pain around the side of the ribs, there's a couple of different triggers that we would want to screen for. So again, with all of these conditions, we're talking about the most common conditions. Obviously we would be screening for anything worrying or concerning or any systemic, so other additional symptoms, for example reflux, stuff like that, sharpness on breathing, that could be adding to the pain. So we're just thinking about purely musculoskeletal triggers today. So one of the most common ones is actually trigger points and myalgia, so pain into our latissimus dorsi muscle, which is our huge muscle down the side of the body. The reason why this can get aggravated and give pain around the ribs is obviously with its attachments blending up into the ribs and up into the shoulder blade and up into the kind of the armpit area. But what we also find is if we're guarding and we've got pain into the side of the rib as well, it's very common that that muscle has contracted or gone into an antalgic posture, so a posture due to pain, or a guarded position. So what we typically find is it's really sore when they're kind of reaching up into the arm and they can feel it pulling down into the side, potentially worse for breathing. And what we normally find on assessment is if we're loading the muscle on adduction, so we're resisting as we're pushing the arm down, it normally aggravates a little bit of pain. And also we find that it's normally very tender to touch all the way down into that muscle and round the back of the shoulder as well. What we also find, same around the front, is intercostal muscle strain. So big deep breath in as the ribs expand might trigger localized pain around the side of the rib cage, and again pushing on certain points, it's normally quite localized into that muscle. One of the key things that we'd want to know is if there's been a traumatic onset, is there the potential that there could be a stress fracture. So what we normally say is obviously go and get it x-rayed, getting it assessed first, making sure that there's nothing worrying going on into the side of the ribs. If there's not been a traumatic onset, but someone, for example, was female and elderly, and there may be the risk of osteoporosis, you also want to rule out any kind of fracture into the ribs due to that as well. So when anybody comes into our clinics, we always try and do a big kind of full picture of this person, of any other thing that could be going on, but mechanically intercostal latissimus dorsi. If we're finally thinking about understanding pain around the back of the rib cage, initially some of the most common conditions that we see is dysfunction or inflammation into the costovertebral joint, so where the spine and the rib head blend together. We can find that this can become really aggravated, or the costotransverse joints are coming down lower. So what we typically find is it can be aggravated on spinal movements because of the attachment, so it might be worse if someone's being static or sitting for long periods of time or standing. It's normally very localized over the joint, but can also give referred pain around the side of the rib, and it's same as around the front, just obviously the pain is localized around the back. It's worth for coughing, breathing, twisting, because again, if we're thinking of rotation of the spine, you're rotating the ribs as well, so sometimes that can make it worse. And so it's really common to have that pain around the back of the rib cage. So this is why when we're treating, assessing, diagnosing, we're looking at the rib cage as a whole. So if we're thinking about understanding rib pain, you need to think about, well, if we're going to understand rib pain, we need to understand how the whole of the anatomy is interacting together. Definitely recommend getting it assessed. So if you're doing all of our videos, fantastic, obviously we're here to help, but you will have a bigger benefit if you get your rib pain assessed first, you get a diagnosis, you get an action plan with your musculoskeletal expert, and then you can always bring in the management and the treatment later, which is aimed at improving rib function, reducing pain, reducing tightness, and improving the mechanics of the spine and the ribs long term.